So, welcome everyone to our conversation this afternoon. This interview with my good friend, Dr. Kerryn Phelps, is part of our 12 days of wellbeing and self-care leading up to Christmas. We know that this past year has been a very challenging one for many people who've gone through from drought to bushfires to floods in some circumstances, and then into lockdown and dealing with the stresses and strains of COVID-19. And here we are at the end of a year, and I guess many of us feel like we've just survived this year, and hopefully some of us feel like we've thrived throughout this year, even though it has had plenty of its own challenges. It's a real pleasure for me to talk to Kerryn because we've known each other for many, many years. We were trying to think about when we first met, and it was probably at an AIMA conference, which is the Australasian Integrative Medicine Association, their annual conference. And Kerryn was often a speaker at those conferences, as was I, and that's how we came, I think, to meet, even though we both knew about each other long before then. So very warm welcome to you, Kerryn. Thank you so much for joining us today.
Thank you, Petrea. It's a pleasure to be involved in these conversations, and it's a pleasure to see you again.
Yeah. You know, these are such important conversations to have because so many people scrub up well, but that doesn't always indicate how they're actually feeling, which is why we often say to people, do you feel as good as you look? So, do you feel as good as you look today?
Look, I've really found this year an interesting challenge. Many things have changed, and I think one of the important things about this year is to see what we might have gained in amongst what we might have lost. And I think that for many people, for example, grandparents, we lost a lot of contact with our little ones, with our grandchildren, and I think that was, very hard and quite an effort to keep up a contact with them by FaceTime, phone calls. With little toddlers, they don't understand that they can't, come and see you and run over and hug you. And I think that's been really hard for a lot of people. I know it's been hard for me, having a lot less contact with our little boys.
Yes.
There's been a huge challenge at work as well. I mean, in general practice, we had to deal with an unknown risk to our staff and to our colleagues who are working in the front line. We had to change a lot of what we did. We had to start wearing masks all day at work. We got into scrubs. We had to put screening processes in place. And I spent, the first many weeks just reevaluating everything that we do, all of the infection control practices in our practice, and being worried a lot of the time that something would slip through the net and that one of our patients or one of our staff would catch the virus, and then the implications of all of that.
Yes.
I guess from my point of view, on top of all of that too, because of my background in health communication, I saw that the communication around this virus was very messy at the beginning. There were a lot of very mixed messages, and people were very confused. And so I really felt an obligation, in amongst all the other things I was doing, to step forward and to provide that kind of, I guess, practical, usable information for people that was based on the best possible evidence. There have been, I think, a lot of friendships and relationships that have been tested and strengthened during this time. And so I guess as we're coming towards the end of the year and heading towards the new year, it's really worth, I think, like it is every year, to have a think about all of those positives and negatives and lessons learned from the year.
Yes. Well, I know you were one of the very early voices speaking out for masks, and in the time when there was quite a lot of confusion and conflicting messages, and finally you were proven right on that. But it took quite some time for people just to know what practical things they could do other than washing their hands incessantly. And like you, we went through a very long procedure here at Quest so that we became COVID safe for our participants. We opened for programs again in July this year. And while we now only have one person per bedroom, that's limited the number of people in a program, but it's also increased the number of programs that we subsequently run. So given that I imagine you feel there's quite a pull on your time, whether it's from interviews with the media, whether it's from your patients, whether it's from your family and your loved ones, how do you find a way of creating some semblance of self-care in amongst all of that, and maybe what the value is of you practicing those things that really do look after you and replenish your spirits as well as your physical health?
I try as much as I can to practice what I preach. I sometimes don't, and I have to pull myself back into line and say, no, you've got to go and have your regular medical checkups. And so I've been spending a bit of time in the latter part of this year just making sure that I'm all up to date with my usual general checkups that we all should be doing on a regular basis, because you can't let that slide. And in fact, a lot of people let that slide through COVID because they were frightened to go into a medical setting. So those basic things like that, looking carefully after diet. Cooking at home is something that we really enjoy doing, and Jackie tends to do most of the cooking. But sort of meal planning and looking after nutrition very carefully is something that I think we've had a real focus on. In fact, my daughter Jamie, who's a dietitian, and I published a book called Everyday Food as Medicine during the whole COVID lockdown, and so that was quite fun, trying out some of the new recipes in that book. A bit of a family event, and exercise has been important, even those days where we were only allowed to go out for exercise, and it's almost hard to take yourself back to that period of time now where you were only allowed to go to the supermarket, to essential services and to exercise. Jackie and I made sure that we got out, we walked our dog every day, made use of that time that would exercise, even though we were wearing a mask, because a lot of the footpaths in the city in particular were quite crowded, in the parks. And also behind the scenes, I was also providing advice to the CEO of City Council, where I'm a councillor, and trying to provide as much evidence-based and practical advice as I could about council services and community centres and the pools and gyms and things like that. And so I have to say I did feel that I was making a very practical and positive contribution to other people, which also gives me a sense of having contributed as well. Of running the practice, we had we made sure that we got our team together on a very regular basis, more frequently than we otherwise would have, because we couldn't all meet in the lunchroom, for example, and interact and talk as we would normally do in the middle of the day. So we had to arrange times at night where everyone got together on a Zoom meeting, and we talked about the challenges. We talked about things that were going well for everyone, things that were perhaps needing some adjustment, and maintaining that communication, and trying to maintain also communication with friends and family. During this whole COVID period, our youngest, Gabby, who you know, turned 21, and we had a big 21st birthday planned for her, which had to be cancelled. And there was a disappointment for her, but I was really very proud of the way that she accepted that was reality. And we ended up making it a very special day for her in a COVID-safe way, but not with the big party. And, I've had a lot of her other friends who are turning 21 this year as well have had to come up with inventive, imaginative, creative ways of celebrating, of acknowledging special events. We had a friend also who turned 60 this year, and she had a big 60th birthday plan. And so the way they organised that was to have a Zoom party where they sent champagne around to everyone who was invited to the Zoom party. And then they had people from all over the world who met at a given time. They had a musician who did, some of the music for it. Everyone toasted her with the champagne. She cut a cake, and everyone got to have a chat about it. So it was very creative, and a way of people connecting with each other for a special purpose. So while this year's had its challenges, I think it's also brought out a lot of that inventiveness and a lot of the Australian spirit of resilience.
Yes, isn't that wonderful? So I imagine, as you say, lots of people found creative ways of still acknowledging important dates or important anniversaries and so on. But I imagine too that you might have seen an increase in your own private practice with people who found the time actually very challenging, or who may have had other health issues that really compounded their fears and anxieties. And as you said earlier, some people avoided going near the doctor because they were afraid of catching the virus. So have you seen a change in people's mental health over this past year?
Yeah, look, practice has been another interesting challenge, another change in the way we've had to do things. We've had teleconferencing for consults, which is our first telehealth or teleconsulting, and that's been something we've been talking about for a couple of decades. But we now have the technology and the means, but we also have the government's willingness to support teleconsults, and that's been, you know, really terrific, because there are people who it was in their best interest not to leave home for a medical consult, and there were things that we could do, particularly, as you say, mental health consults, that we could do in this kind of way over a Zoom or a FaceTime conversation, and there are now medical platforms where we can do that. There are a lot of people who found the time very stressful, people who lost their jobs, people who were working in hospitality, entertainment, tourism, who couldn't work and went into financial difficulty. There were people who couldn't pay rent and had to move in with friends or family. And so, you know, in general practice, you know, we have to find ways of helping those people in practical ways with advice, and you know, in the ways that GPs are there for people through thick and thin. So we did have quite a number of people who found some very significant difficulty through this period of time as well.
Yes. Yes, I imagine particularly for those who already suffered with anxiety, although I know some people who suffer with social anxiety really enjoyed lockdown because they didn't have to go out and mingle with people.
That's
but
true.
for many people who are already a little isolated, loneliness can be a huge issue for them as well, and certainly compound some mental health challenges that people might have. So when your patients come to you, do you give them general advice as well around nutrition and exercise and sleep, some of those really practical cornerstones of managing your mental health?
We have to do a lot of triaging. With the teleconsults, some of those things that I mentioned, you can safely deal with a teleconsult, but and particularly if you know someone very well. But there are a number of times where people had a teleconsult and it was very clear that they should have been triaged into an urgent consult or a trip to hospital. So we did have a few people that we had to encourage to come in and have a face-to-face consult, and then we had to organise either surgery or an acute visit to the hospital for emergency treatment. So that meant that we had to sort of change our triaging processes as well, and that was really important. In terms of the general advice that we give to people, look, any kind of mental health condition is going to have many determinants. It's going to be around, you know, whether somebody is socially isolated or not, whether they are financially secure or not, whether they are looking after the fundamentals of health, like their sleep patterns. A lot of people's sleep patterns became disrupted, and people were describing quite strange vivid dreams during the COVID period. I don't know why that was, but it's a phenomenon that people have been talking about. To making sure that people exercised regularly every day, and people had to change their exercise patterns, because where a lot of people would get up and go to the gym, with the gyms closed, people had to go, well, how can I exercise? Or if they used to go to the beach and surf or swim at the beach and the beaches were closed for a period of time, what do they do? Where do they go? Having to change those patterns and not just say, well, I can't do what I normally do, so I'm just going to sit. You know, that wasn't an option. So, you know, people were taking up online yoga. They were taking up online aerobics classes. I know my youngest daughter was doing aerobics classes on the balcony because she couldn't go to the gym at the time. A lot of people took up cycling because it was something that they were able to do that was reminiscent of doing a spin class, for example, but it was out on the road. So people were changing patterns a lot. And so I had to work with people as to what they wanted to do, what they felt like doing, and then providing some motivation for them to actually change that. A lot of people who live out, who would eat out all the time, had to learn how to cook. And so, just directing people to, a healthy diet, ingredients that they enjoyed, and then a cookbook where they could start putting recipes together. Some people hadn't cooked at home dinner for years, and they were suddenly, discovering that they were fabulous at making pasta or something. So,
indeed, some places don't even have kitchens these days. They only have a microwave and a sink.
Yeah, so a lot of new skills emerged during this period of time too, but it has been a time of transition, and with transition can come anxiety, and a lot depends on the life skills and the coping skills that people have learned through going through difficult periods in the past as well.
Yes, we've certainly found a doubling in our demand for our programs since July this year. It's just been phenomenal, and there are people, of course, who've been through the bushfires, and then we also see a lot of women impacted by domestic violence and relationship breakdown. As some people, when they lost their job, they also lost their partner because their partner was very much interested in the lifestyle that job created. So people have been dealing with real enormities, and I think some people too have been reflecting on the life that they were living pre-COVID or pre-bushfire even, and recognising actually there are some parts of that I don't want to go back to. I'm not sure that I want the level of pressure that I had, and that now maybe there'll be some interesting mixes, not for you because your work is so much face-to-face, but for many people I imagine there'll be a balance between working from home and then going into the office. And so it is a time of great flux and change in our community, and there's always an upside and a downside to that. Some people love change. I'm a little bit like that. I love roller coasters, but I wouldn't get on a roller coaster without a seatbelt. And I think change and living on the planet is a little bit like living on a roller coaster. We don't know quite what's over the crest or around the corner. But it is our job to find and fasten our own seatbelt, which is the sure knowledge of how to look after ourselves physically, mentally, emotionally, spiritually, so that when the unexpected, the unthinkable, the unimaginable happens, because this is planet Earth where it all seems to happen, we're more easily able to adjust. Oh, the scenery's not what I expected. However, this has happened. How am I going to respond to the fact that this has happened? Rather than this shouldn't have happened, I feel a helpless victim of my circumstance and just get stuck in railing at it. So I imagine you'll see quite a bit of that in your practice too, as people kind of find ways of reinventing themselves. And maybe 2021, as we come to the end of the year, it's, as you said, it's often a time when we reflect on, well, how did we do this year? And maybe there are some things that I want to put into place for next year that will help me to be more resilient. Have you considered any things that you want to incorporate next year that are new for you?
Well, it's interesting because obviously we learn from our patients and our people who we engage with professionally. It's a two-way street a lot of the time, and so I'm watching it. Some of the changes that people are putting in place in their lives too, and it informs me about how I want to be going forward. And one of the things that I've discovered is that life, as you said, is a roller coaster and it's full of surprises. And I've always been open to opportunity and open to the potential that life can present. And so we just sort of have a look at how life presents itself going forward. Lifestyle is really important. Spending time with the people that I care about is really important. My work is important to me. And so in whatever form and shape that happens, I'll continue to do that and continue to, look after those fundamentals of healthcare that I spoke to you about and self-care. And I think one of the things that this time period has taught all of us is the preciousness of our close relationships. And, the person or the people that we live with in our household, the people who care about us, the ones who check in to see how we're going, And, you know, these are important. I think reinforcing those close supportive relationships has been a really important part of people getting through this period of time. And sometimes I think when you're going through a very difficult period, as Australia has been in this last year, sometimes it's only in retrospect that you say, oh my gosh, that really was just so difficult, and look what we've achieved and look where we've come in this period of time. And so I do think it's also important to focus on having survived this period, having got through it, the lessons that we've learned out of it, what we want to take into next year. And you know, it's interesting you talk about people working and living differently, because many people that I've spoken to who have been working from home, some of them since March, a lot of them are saying, I'm going to reassess everything about the way I work. And there are people who won't get on a train and go into, you know, the city 5 days a week. You know, that they will be spending some time working from home. They will have more flexible hours. They will have more meetings on Zoom. There are people I've spoken to who said they're not going to get on a plane and go to Melbourne or Brisbane for a meeting, that they'll do that meeting on an online platform, because it is very straining on your body to have those kinds of trips for the sake of maybe an hour or two or a couple of days meeting. There, you know, I know people who are going over to the USA before COVID for a 2-day conference, and you know the strain, you know, and now they're saying, you know, we can do online conferences. Yes. You know, we can interact with people. We can, you know, we can actually learn from each other. We can teach each other without necessarily having to physically go to the other side of the world.
Exactly. I'm sure that's a huge change that we've all experienced, that we can accomplish a great deal via these online platforms and meetings rather than doing it in person to person. I know one of the other things that I've often seen over the years with people is that when we're going through a crisis, we very rarely deal with the emotional impact of that crisis at the time when we're going through it. So, for instance, it's very common for a woman who's diagnosed, say, with breast cancer, all the emphasis is on, you know, understanding the medical terminology, getting through all of the testing, maybe having the surgery. And then 6 to 8 or 10 weeks later, when all of that's over, is often the time when she falls in a real pothole. You know, I've just had cancer. Do I go back to being the woman I was before? But then that was the woman who got breast cancer. Do I make this a little molehill in my life, or do I make this a major catalyst for change? And I wonder whether after this year where so many people were traumatized from the bushfires, and then there was really no time to even take on the enormity of what had happened before we were into lockdown and with COVID. And so that has gone on for a period of time. I do wonder whether, as we get to the end of this year, whether we may not see quite a number of people who suddenly are a little confused by the fact that they feel so tired, that they're just exhausted, that maybe they're a bit more tearful, maybe they're not coping so well, maybe they're a little more snappy, or their memory's gone. And we know memory is one of the first things to go when we've been through trauma. We also know with trauma that it dysregulates the sleeping patterns. And so during the day, when a person, their brain ought to be in beta, you know, in that fairly fast brainwave pattern, it's at that time that they're actually in delta, which is when people feel zoned out and a bit split off and a bit numb and a bit weird. And that when they're meant to be in that deep sleep level, in theta, they're actually in beta. And so their brain is super active at night when they're actually meant to be in a much lower, slower brainwave pattern. So I do wonder whether, as we come to the close of this year, which is the normal time when people reflect on the year and their life and how they're living it, and indeed, as you said too, a lot of people say, oh, I must get that lump checked out before Christmas, or I must have that blood test, or I must get that mole checked. A lot of people leave it right until December to go and have some of those medical tests, and then they do find they've got an issue, and all the medical services go on holidays. And so I wonder, whether we are going to see people who are struggling a little bit more mentally towards the end of this year as the first opportunity really that they've had to kind of breathe out and take on board the enormity of the challenges of this year.
Well, people are not able to travel overseas at the moment, and so people who would normally have used an overseas trip at the end of the year as a circuit breaker are not able to do that now. And so people are discovering Australia, and they are discovering places in Australia that they've heard about perhaps but haven't visited, or haven't visited since they were children, and doing different things like going camping, or going and hiring a house for a group of friends or whatever. And so there are different things that people are doing for holidays, and I think planning a holiday and not feeling as if you can't have a holiday is going to be really important. My heart goes out to people who have family overseas, particularly over the Christmas, New Year period, when they would normally see. I've got friends who haven't actually met grandchildren who were born during the year, and they're just not able to get on planes to get to the US and back, and so that's enormously difficult. And so finding ways of connecting with family again through online platforms, it's just not the same thing. But we have to try and maintain those really important emotional, social connections with people who care about us and who we care about. And I think that just thinking about that aside, the people that you can't connect with, but then ways of being able to connect with people. For example, now that the borders look like they're opening up interstate, we can visit interstate family and friends. We can travel sort of to country areas, to parts of Australia that you think, oh, I always wanted to go there. And so rather than seeing obstacles and barriers, I think we have no option but to see possibility. Mm-hmm. And so, for me, meeting an obstacle means looking at other possibilities.
Yes.
And so I think coming up towards the end of the year, plan a holiday, plan a break, plan to do things differently. I mean, I even talk to people who live in Sydney who've never climbed the Harbour Bridge, who've never taken the ferry to Manly.
Yes.
To be a tourist in your own area, in your own city. I mean, I'm sure where Quest for Life is, that there are walks that people could do that they haven't done before. There are
indeed
places to go that give you that sense of exploration and adventure without having to leave the country.
The great thing is the brain doesn't know what's real. And so when you plan a holiday, Wendy, my partner Wendy, is a great one for planning holidays. And we've got pretty much every Lonely Planet that was ever printed. And they're all full of little post-it stickers of where we're going to eat, where we're going to sleep, what we're going to do, where we're going to go. We don't actually go anywhere, but she gets so much, and that's not entirely true. We have had many
I could just see Wendy doing it. I can see her doing it.
And look, she gets so much pleasure out of just planning a trip, even though we may never take it. And the brain, the brain is having a fabulous time savouring all the flavours and the aromas and the vistas, and you don't actually have to leave the kitchen table. So that's another alternative for people who physically can't literally get out of their home at the moment.
Go on a virtual holiday.
Yeah, exactly. So you feel like you've navigated this year pretty well by the sounds of things.
Well, I'm an optimist, as you know, Petrea. I try to see the positive in things. I try to see opportunities rather than obstacles. And I also, I'm very aware of how fortunate I am in my life, and the fact that I have had opportunity and choice. I've been able to live in a country where I've had an education where I can work, whereas as a woman I have rights that perhaps other people in other countries don't have, opportunities that other people in other countries or other situations don't have. So I think we can spend a lot of time thinking, about how terrible things are, but I think at the end of the day, yes, terrible things can happen, and then we need to be able to work through those things. And that's not to say in my life I haven't had periods where I've been stuck and I've had to get help to get onto the next phase with advice and assistance from friends, family, or professional colleagues. And I had a major health issue back in about 17 years ago, where it was a near-death experience, and I had a major pulmonary embolism in my lungs, and that was a very much a resetting process for me. And when you've been through something like that, if you're feeling as if things are a bit tough, you think, well, every day's a bonus, and you just try and make the most of things.
Yes, yes. Well, I know that you've been a great gift to many people this year through your appearances on various programs on television, and in the advice that you've given, because so many people do trust you for your medical advice. It's clear that you're passionate about your profession, and that you really have in the forefront of your mind the service that you provide for humanity, in that bringing that wisdom and that knowledge to bear in really practical ways. So on behalf of everyone, I really thank you for sharing yourself so generously with the Australian public over this last year. And I know they would also join me in wishing you a really replenishing and restful festive season. I hope you do get to hug those grandchildren. I think some of my little grandchildren think that I live in a computer on the screen and have forgotten that I'm actually a real live human being. So I can't wait to grab hold of them at Christmas and give them a thorough hugging. So I hope that you get to do that too.
Thanks, Petrea. Love to you and Wendy.
Yes, to you too. And thanks so much for your time today.
Thank you. Bye.
Thanks. Bye-bye, Kerryn.